Open Your Eyes is brought to you by the Belize Bank. Our country, your bank.
Welcome to Open Your Eyes.
Start your morning right. I am John Palacio.
And I'm Marlene Cuellar, and thank you for joining us this morning.
Yep, it is a lovely Wednesday morning out, and we're starting our morning right by being distant. Huh? We're distancing ourselves. It's social distancing.
Let's get to that immediately.
Look at
of course,
that.
we're keeping it as safe as possible as we can in the studio.
Yeah.
We hope that you are too in your everyday life. We understand that some people still have to go to work, but that doesn't mean that you can't practice social distance while you're there. 3 feet or 6 feet is preferable. And that's what you want to aim towards. And of course, we'll be talking about things like that.
Definitely.
During the course of the show, we'll keep you updated, and there's a lot to report on today as well. But we'll be checking in on our weather to find out what we can expect in just a bit.
Definitely. That's, of course, our first order of the morning, to make sure you know exactly what to expect with the weather for today.
That's right. And we'll go ahead and read our prepared forecast for today. The general situation is fair, warm, and dry weather to prevail over the area.
In the 24-hour forecast, mostly sunny today and clear to partly cloudy tonight. Little or no rainfall is expected, along with seasonably warm temperatures across the country.
All right, our winds are moving from the east to southeast at 10 to 20 knots, and our sea state is choppy to moderate.
Well, I'll tell you what, high temperatures for today ranging as high as 89 degrees Fahrenheit coastal, 94 degrees Fahrenheit inland, and a cool 84 degrees Fahrenheit up in the hills.
That's right. And tonight, along the coast, we're expecting 78 degrees Fahrenheit, inland 72, and in the hills 66.
All right, as we throw out to you the outlook for the next couple of days, for Thursday and Thursday night, it is for continuing seasonably warm and dry weather conditions.
That's right. Dry weather is here.
I know, right?
You know, with temperaters like those, I don't see why we have to tell people to stay home.
Stay home.
You should just want to. It's hot out there.
I need to stay home front of my Lasco.
Exactly.
Yeah, that's what you need to do. But I'm so proud of the fact that a lot of people, of course, are practicing social distancing, being downtown. You see a lot of people actually telling you, stay far.
All right, let's keep things moving now with our eye opener for this morning. And our eye opener taken from dailyom.com goes like this. Hatred cannot help but be transformed into the presence of love. Hatred can be irrational, and it has a greater impact on the individual who hates than the person or object being hated. Yet overcoming hatred is difficult because hatred reinforces itself and causes greater enmity to come into being. The most powerful tool one can use to combat hatred is love. Deciding to love what you hate, whether this is a person, situation, or a part of yourself, can create a profound change in your feelings and your experience. There is little room for anger, dislike, bitterness, or resentment when you're busy loving what you hate. Gandhi once said, "Be the change you want to see in the world." Loving what you hate sends a positive, beautiful energy to people while spreading peace and harmony throughout the planet. Instead of reinforcing hatred, you become an advocate for love. Hatred responds to hate by causing anguish, but hatred cannot help but be transformed in the presence of love.
My goodness, Marlene. I love this too. I love it simply because it is factual. What is telling you is, why waste your time there? Why waste your time there when you could actually find love within it? Find the love you can, as much as you can within it, and you'll find out that nothing else matters. Just by you reading it, like, I feel so cozy about it, because there are a lot of people who are not able to find it. Because to me, they're not looking for it. So why don't you, and like Gandhi said, loving what you hate sends a positive, beautiful energy to people while spreading peace and harmony throughout the planet. So if you try to find love or peace within something that you feel might not be, and you find it, my goodness, oh, what a wonderful thing it can become. That's how I feel about it.
Well, I don't think anybody expects to think of loving what they hate or who they hate. That's I think, a jarring concept for people to hear. It's not how we normally view things.
Yeah.
But what I think the eye-opener reminds us is just, and I think for me the opening part is the best. When you carry hate, you hurt yourself.
You hurt yourself?
Far more than you hurt the other person. Yes, you can do mean and terrible and disrespectful things. But at the end of the day, most likely the person on the receiving end is a lot less consumed by that hate, is investing a lot less energy than the person who carries it. And I think that really is perhaps a very telling point for us. If you think of how much you want to, if you hate someone so much or something so much, imagine all the energy you spent on something you're saying you don't like.
Yeah.
So it's so counterproductive. And I think for me, that's just the point that really rings home. How much time and energy do you want to spend on not liking, hating, disrespecting, plotting, being spiteful on another person? Like, if you really think about it, it's kind of foolish. And we have those feelings sometimes. And it can be towards anything. But just consider where you want to spend your energy. That's just what it is. And I think that is, for me, the most important point. We have limited time in the day. We have limited things that we can accomplish. I'm not going to spend all my time perpetuating hate towards someone else, because there are other things I can do. I mean, is that so?
You're so right. You're so right. I hate you. Okay, but it plagues your mind afterwards. Like, you're just the one just eliminating you're eliminating all this negative energy, and it's on you. You tired then, So and it goes to.
For me, that's why indifference is so much easier. It's just.
But and I'll take it another notch. I once met somebody who said. And this goes to not only individual, but something that you're doing. Yeah. And if you find yourself hating what you do, then look, you just waste your time. Why not try to find something within that you could reckon with, and you love to you move on with respect to it. But you're totally right. I love this eye opener, and I think that it's a great way to start your morning.
Well, that's right. And we got to get moving into our next segment. Of course, it is, we have been consistently talking about the novel coronavirus when it became COVID-19. We confirmed the first case on Monday. Yeah. And of course, we are expecting some very important results today as well. And we are actually going to get moving into our COVID-19 update for today. There are a couple things that we want to let you know and keep you up to date with.
Okay.
So, so far, we know that there was a first confirmed case in San Pedro on Monday. A 38-year-old woman returned from Houston, returned from Los Angeles, traveled through Houston, and then went on to Belize and then San Pedro. The Ministry of Health started their contact tracing, or their mapping, to see who all she came in contact with. As of yesterday, as reported by the Ministry of Health, 34 people are being tested.
Okay.
And those are people who've come in direct contact with the patient. Okay. So we are awaiting those results. There's a time frame that it takes to be able to process and to get the samples there, collect and get the samples there. We know the Central Medical Lab is capable of conducting those tests. 2 persons were trained. They have then trained additional persons within the lab itself, so they're capable of doing the tests there. We also, of course, the state of emergency continues, even though the mapping exercise has been concluded. I believe they're waiting on the official results from those tests before they can allow movement. The images we have seen from San Pedro so far, and we got to give them kudos, is that people are listening. The streets are empty.
Yeah.
And it's crazy to see it because we're always used, anybody who goes to San Pedro is used to seeing the hustle and bustle of the town. It has an energy on its own.
Yeah.
But it is so inspiring. It's encouraging to see people listening to the warnings and staying at home. Remember too, if you are at home, there is a limit of 10 persons. So even in your households, try not to congregate in groups larger than 10. That is the official advice from the Ministry of Health.
We're looking forward to these tests for today, and we'll know exactly how to move forward thereafter. But like you rightly mentioned, I feel the folks of San Pedro are definitely to get the kudos, simply because they're adhering to the 72 hours that they have been instilled in terms of state of emergency. I think that the entire country should take this, especially what San Pedro is doing right now, take it into heed and try to move on with that. We are trying our best to let you know that the best thing for us to do is to listen to our authorities. And yes, listen to our authorities. So here we go. This is the update. And also, BEL announces it cannot offer light bill waivers.
Yeah.
Now we know that for some people it might be up in arms, but we're not able to tell you exactly what that company is going through.
Well, we do, because it was in the news last night. I think that one of the things that we heard, and this is definitely something that people have been clamoring for, they want relief, understanding the difficult financial situation a lot of people are finding themselves in. Yesterday, Belize Electricity Limited disclosed that they would not be offering a waiver on light bills. They're expecting people to pay. Their current position is that they have to pay a substantial sum for the purchase of electricity, and that there's a very minimal room that they have for allowing people to not pay.
Yes.
This is something I assume. We do have the Prime Minister's press conference today, and I should actually say the task force, because it is co-chaired by the Prime Minister and the Leader of the Opposition. They're presenting some of their financial relief suggestions this morning, or actions this morning, and I'm sure that's going to be a question that will be asked, because Belize Electricity Limited is in fact the government holds majority shares in the company.
Yes.
So while the officials have put forward their position, we'll see what the task force is saying, and primarily the Prime Minister.
All right, so we're looking forward to that press conference this morning. And local banks, for example, Belize Bank, Atlantic Bank, Scotiabank, they're offering relief packages for customers.
Yeah. Well, this is an interesting one, and I think that people should be very careful about reading fine print. I also saw Holy Redeemer Credit Union putting something out as well. The banks are offering different things in terms of loan waivers, reduction in interest. There's a number of other things that they have in place, but be sure to read your bank's press release very carefully. In some instances, I know some banks are offering relief for people who have been directly financially affected by COVID-19. Now, what that means, because it could mean, if your business, loss of revenue, it could mean for an individual customer cut in salary, or 2 weeks without a salary, or it could mean that you've lost your job. I can't answer that question for you. You will have to contact them. Some banks, like Atlantic Bank, has offered a general, all customers are going to benefit from their relief efforts.
All right. And finally, Social Security accepting claims online at claims@socialsecurity.org.bz.
And of course, we had that conversation yesterday, right here on Open Your Eyes. We talked about changes that would be coming. One of the things that they're keeping in mind is that they have to keep their doors open to be able to serve the public. And that means that they want to minimize the traffic. Now, if someone goes into isolation or is quarantined for COVID-19, then they would be out of work and they would have to make that claim. Typically, you have to fill out the claim form, take it in by the second day, so that you can get your Social Security benefits. Now they're saying two things. One, you can submit those claims online. The claim form is downloadable online. You can download it, fill it out, email it back to Social Security at claims@socialsecurity.org.bz. And they will accept it. They're also allowing for you to be able to submit that after the 2 days. There's no rigid timeline that will be enforced in being able to submit that claim. So that's very critical for people who are out of work at the moment. And there should also be a drop-off box where you're going to be dropping off claim forms if that's what you prefer to do in front of the office itself. Be sure you have your contact information very clear so that they can follow up with you on your claim.
Definitely, and of course, if you'd like some more information on that, you could contact the nearest Social Security Board office in your area, so you get exactly where they're coming from, and you could stay on top of things with current information.
That's right. And so that is our COVID-19 update for this morning. Those are the major happenings over the past 24 hours that we can tell you about. What we can tell you to anticipate as well today, again, is that presentation that will be made by Prime Minister Dean Barrow and Leader of the Opposition John Brisenia today.
Definitely.
We expect to hear what's going to happen in terms of their support for the tourism sector, those who've been affected, and any other major changes that may be recommended. We don't, people have been asking a lot of questions about what our next step is going to be. And I guess we'll get some of those answers today. You can expect, of course, to see that live on our News 5's Facebook page. So just wait for, just log on and you can be able to watch it there.
Definitely. So for first-hand information, make sure that you log on to Facebook and check us out on our News 5 Facebook page.
Yeah.
Speaking of that, Marlene, as we move on for this morning, we've got 3 conversations lined up for the morning, for this lovely Wednesday morning, actually. And we'll be starting off this morning with a conversation with CARFA's Executive Director, as she shares regional perspective on COVID-19.
Of course, she's going to be joining us live from Trinidad. We're going to be doing a video interview with her. Of course, CARFA is the Caribbean Public Health Agency. We are members of CARICOM, and this is kind of the public health group for that. And they're going to be sharing just a bit about what's happening with our Caribbean brothers and sisters across the region, what the expectations are, and really helping us to understand what efforts are being made as a region.
Definitely. And in our second segment, it's difficult to have conversations at home, but I'll tell you what, conversations must be had. And in the second segment, we'll be talking to a professional on talking to children about COVID-19.
Great, very important conversation. And then we're going to have representatives of the management of Belize Medical Associates on their recent announcement. Of course, this is a private, private healthcare facility, and they've actually decided that they will not be seeing COVID-19 cases. So we're going to find out more about that decision, why they decided to do it, and the details about that.
Definitely. We need to take that break, but just before we do, we want to say a happy birthday to none other than Belize's very own Pulu Lightburn. Happy birthday to you, my brother. It comes from all of us here at Channel 5 and all of us right here on Open Your Eyes. There he is. You can't miss you that dread day.
Right.
And it's so long. But
so do remember, any celebrations, keep the group small and keep some distance between you.
Definitely. And
don't blow out your candles.
Don't especially if everybody is across the room. And one final birthday shout out, I'd like to say a happy birthday to Kyle Castillo. My brother, all the very best to you. Happy birthday. Do hope you enjoy your day today.
So we're going to go ahead and take that break. When we come back, we're going to be joined by the Executive Director of the Caribbean Public Health Agency, joining us through live stream from Trinidad. So please do stay tuned.
With over 100 years of service excellence in Belize,
And welcome back to Open Your Eyes on this lovely Wednesday morning. We are now moving into our first conversation for the morning, and we'll be talking about COVID-19 and how it's affecting the Caribbean. As a matter of fact, with us live from Barbados is the Executive Director of CARFA, none other than Dr. Joy St. John. Dr. St. John, good morning and welcome with us.
Good morning.
And
I haven't been to Belize before, so a virtual visit is just as good.
All right. Well, I'll tell you what, we will make sure that whenever you're able to get to Belize, you'll be greeted with a warm Belizean welcome.
Yeah.
I'll hold you to that.
All right. So let's get on into the conversation as to, firstly, we've been hearing CARFA over the past few weeks, and Belizeans are very interested to know what is CARFA and what it does.
The Caribbean Public Health Agency is the amalgamation of 5 regional health institutions, and I'll give you the names. It's been in operation for just 7 short years. The Caribbean Epidemiology Center and the Caribbean Food and Nutrition Institute were both PAHO institutes. They were merged into what is now CARFA, along with the Caribbean Environmental Health Institute, the Caribbean Regional Drug Testing Laboratory, and the Caribbean Health Research Council. So we do at CARFA more than usual public health institutions do. Apart from the usual surveillance, we also have food and nutrition, we have drug regulation and testing, quality of drugs. We have environmental health and environmental management services. We have the annual research conference. And so CARFA has a lot to bring to the COVID situation. Of course, we do NCDs, and so this is part of how we have been looking at how COVID-19 could affect the countries.
Yes. You work with countries across the Caribbean, and in fact, very early on in monitoring what was happening globally, helped to guide how much at risk we in the Caribbean were.
Yes, that's right. CARFA serves 26 member states. Some of them are overseas territories, British, Dutch, and French. And what we did, because we also have a very strong tourism and health program, what we did is that we gave our own risk level assessment based on if there were direct flights from a country of concern or not, based on the number of countries in close proximity that had COVID cases. And so while there was a global threat risk of high and then very high, we did not go to very high until we assessed it was imminent that we would have our first importation in the CARFA member states. And I think it occurred like 1 or 2 days after we raised that threat level.
That's right.
But we gradually raising it based on not only what I told you, but also we had been looking at some simulations of how it was thought that this virus could spread out into the world. And so we were watching the flight pattern, and we watched it come up from South America. We also watched it come down from North America. And we kind of guessed, okay, it's about time it will get to the CARFA countries.
So in a span of about 2 weeks, we had the first confirmation in the Caribbean March 10th. And now Belize was one of the last countries to be able to confirm its first case. Was this, in terms of how quickly it has been confirmed across the Caribbean, is this matching kind of the pattern that was expected from CARFA?
Yes, we figured that we would, once we had the first case in the Caribbean, and we looked at the Caribbean, not just from the CARFA member states, we looked other member states. So you will notice that there were French territories that had cases first.
Yes.
We were monitoring from March 1st, and we figured that at the point that it started in the English-speaking Caribbean, we would quickly get many importations from many countries in quick succession, which is actually what happened.
Yeah.
So we're going to be looking at the Caribbean outbreak as a continuum, and not from when a particular country got it. So from the time that, from now I'm going to be monitoring for CARIFORUM member states. So from the time that the first CARIFORUM member state got it, it has been a very short time to get most of the rest of the countries.
Yeah. Let's talk about the current situation in the Caribbean. All countries have been affected at this point?
Not yet.
Okay, so there's one.
There are some that have not announced,
Yeah.
and there's some that have not reported any cases, any importations.
And what countries are, tell us about the status of the countries across the Caribbean. How are they doing?
So I have always looked at this in three phases. Preparedness, which is what we were doing before we had the first importations. Then importation. So we're mainly in the importation phase. That means that the countries are discovering persons who have brought it into their country. Because remember, this is a novel virus, so it has to be brought in from outside.
Yes.
Right.
So they're discovering them, and they're doing contact tracing to ensure that there is not localized transmission due to person-to-person contact. There are one or two countries that have established that, and not in a large measure. You will know that in Jamaica, there are quarantine areas, so that they have discovered that in specific areas. The next phase will be when we have more widespread transmission. We are not linking cases to travel history or contact with someone who has travel history. And it is at that point that we are fully in the transmission phase.
That's a very important distinction that you made. And if we could just perhaps unpack that a bit. So it is expected, the first phase, as in where we are in Belize, that somebody will bring it in. That's what you call the importation phase. And
so that's why I said your first case is an importation.
Yes.
Because it's linked to travel history. It's not someone in the community who had no connection to travel or to someone who traveled. So it's an importation. So the contact tracing around this case and ensuring that all of those contacts are quarantined is very critical.
Yeah. Would you then say that this is perhaps the most critical time for us to be able to be practicing the preventative measures that have been communicated for the past few months?
Without a doubt, because if persons are not washing their hands, practicing cough etiquette, if they are not maintaining social distance, and some countries have also gone, those are the public health measures. See what I did just now, touching my face? You shouldn't be doing that either.
I know.
Those are the public health measures, and they have been amplified in some countries by targeted government measures to reduce the contact of persons. For example, school closures.
Yes.
Restricting gatherings in numbers. Some people 25, some 10. You have extreme cases in Germany where only 2 people can meet.
Wow.
Yes, but the Germans, although they've had cases, the way they're approaching it, their disease burden is being kept under control. And there are actually models for how you can blunt the epidemic curve, because with a disease as transmissible as COVID-19, there are two types of epidemic curve. One, short and sharp, where there is a big increase in cases, it overwhelms the health services. And one where it's blunted, so that disease does not overwhelm the health services. And I'm talking about public and private sector. And there are two models. One is the suppression model, where you really cut everything down. You do border closures, et cetera, no congregation in bars, restaurants, churches, teleworking, all of that. Those are extreme measures. And then you have a mitigation measure where you have less restriction. You will have fewer cases, but it may not stop the overwhelming of the services because of the way in which COVID-19 behaves. It sneaks in quietly. Most of the cases are going to be mild anyhow, so mild, they could be undetectable. So you could have spread quickly and never know. Once you're building up a number of people who have mild disease, you're going to get contact with people who are vulnerable. Older persons, persons with lung conditions, persons with diabetes, hypertension, cancers, smokers. And then you start to see severe, which is hospitalization, but they usually recover, and critical, which is where they are so bad they need intensive care treatment. It is that smaller percentage, the 20%, 15 severe, 5% critical. Those are the percentages from disease in other countries like China. Once you see that, that is when you can overwhelm the health services, because intensive care beds, ventilators, intensivists, the doctors who know how to treat in persons in ICU, but importantly, the nurses, because intense nursing care is what saves people. You do not have enough of those. And in some countries, you don't have any. You should have adult intensive care, high dependency units, pediatric intensive care. In your accident emergency, public or private, you should also have people with the ability to do this, and rooms where people can be in an intensive care setting until they can get onto the wards. Many people do not have those in the numbers that COVID can produce.
And the treatment itself, as you are very clearly saying, it is intense and prolonged.
Yes, what was happening in China is that we were seeing people staying on the ventilators for 3 weeks. But now what is happening is that we're seeing them stay on for 6 to 8 weeks. And this is why you will notice in some countries where the outbreak is really bad, you have an age cutoff. They do not put a person on a ventilator. In some countries, 60 years old, you don't get on a ventilator because they just don't have the ventilators to match the demand.
That's right.
You know,
Now, can I just,
Sure.
the issue, and this is where we put it into perspective. A lot of people may look at COVID-19 and say, oh, it's a mild disease. A lot of people will be able to survive it, and that's the truth. But what we perhaps don't speak about enough is the limited capacity of medical care in individual countries, and specifically when we look in countries like Belize. So it's not that we can't treat it or that people won't be able to survive. It's how many we can handle at one time.
So let me put it, you're quite right, and I'm really impressed at your analysis, but let me put another part to this. COVID-19 has two presentations. One which is like the flu, and that's the majority. And then the other is what I call a transmissible pneumonia. And that is the one that needs specialized care, the ventilators, etc. That pneumonia is not something that you get over quickly. So even if in bacterial pneumonia and other forms of pneumonia that you're accustomed to treating, you can give medication specific to the disease and the person can get better in a shorter amount of time. You don't have that. There is no specific antiviral treatment. There's no specific treatment for COVID-19, and this is part of the problem. There is also no vaccine. When we had H1N1 some years ago, there was Tamiflu. So you could treat and the persons would get better, even if they were in intensive care.
Yeah.
There's treatment. There are drug trials, there are drug cocktails that are available, but there has been no specified treatment regime which has been proven to be effective, safe, because some people are self-medicating or getting some of the named drugs from a doctor, but not following a careful treatment regime. And we've had around the world poisonings and death.
Yes, definitely. That's definitely something that has been spreading as well, and people have been aware that self-medicating and the medication that they've been mentioning about is definitely one that you really need to not do. You need to consult with your doctor. But Dr. St. John, I've been listening to the conversation, and what I got from it as well is that, yes, there are CARFA members without COVID-19 at this particular point. What is CARFA doing in terms of advising them to keep it safe? And do you see the likelihood of these people getting it, especially if their borders and their airports have been locked off?
Let me put it this way. CARFA has been guiding. Perhaps you get a chance to look at our website. We have been giving so much guidance, and we've not only been producing documents, we've been having meetings. We have a CMO chat. The CMOs advise each other as well, what they're seeing, what is working, what isn't working. So we have been, and we've been following guidelines. We have coordination meetings with American Health Organization as well, following the WHO guidelines and CDC in some cases, especially when we were dealing with the cruise ships.
Yes.
So in terms of this whole issue of how you dealt with how the disease came into the country, we produce guidance for conveyances. So that means planes, any kind of boat or yacht or aircraft, and of course cruise ships. We gave guidance, we gave people the best science, and then member states made their decisions. But we have also been testing, and we have also been working with the countries that PAHO gave testing capacity, like Belize, and advising them through the case definition and the testing protocol, because of those three phases. We started at first with a case definition which was linked to travel or contact with someone travel. But we have loosened it up just over a week ago to let people search in their hospitals for severe acute respiratory infection not related to travel. So the member states have to make their own decisions about what case definition and what testing protocol they use in order to make sure that they detect illness in their countries.
What is the testing capacity in the Caribbean? If we look at international news, we know that in some of the more developed parts of the world, they have a protocol of testing as much as possible.
Yes.
In Belize, we were limited at first to 100 kits. Now we have gotten more. But what seems to be the collective standard?
So I can tell you what CARFA has told the 18 member states that they cover. We have told them most recently that they should test everyone who fits the protocol that we have. And remember that we have eased up the protocols, those not having travel history as well. And for those that have been getting their testing capacity and their kits, because it's one thing to get a PCR machine, it's another to get the kits so you can keep the test going. We have been encouraging them also to test, because this was a part of the outbreak that if you don't look carefully, you will have importations and not know.
Yes.
We were also encouraging them to test. I can tell you that the CMO in Belize has been in constant communication, not just with CARPA, but also with the chief medical officers, seeing what else could happen, what measures could be put in place before they're actually detected to try to limit the possibility of importations. In terms of the testing kits, CARFA has capacity in the thousands with orders for more, but we're covering 18 countries.
Yes.
We have also advised countries that have asked us, and I will not say which countries they are, of other locations where they can get test kits that match their equipment. And there are some countries that were not given capacity by PAHO initially, and PAHO is now giving capacity, and there are still more who are getting their own capacity separate and apart from PAHO, because PAHO gave equipment, reagent, and training.
What are your thoughts in terms of how widespread testing should be, especially after the first case is imported?
As much as possible. You also need to understand that apart from the testing, there are some surveillance measures, and we've been encouraging countries from the start. Look to see what is their level of influenza-like illness and compare it to the previous year's numbers or the trends, because most of them would have information for years and they would be plotting trends. What are the trends for this time of the year, or what are the trends for this part of the country? So we've been asking countries to monitor that. So even if they don't test, if they see increases, they should check to make sure. The other thing we've been asking them to do is to check hotspots. Now, you've got older persons in nursing homes.
Yes.
They are very vulnerable. You should be checking the level of illness in the staff and also in the old persons. If there are any suspicious deaths related to influenza-like illness or pneumonia or anything like that. And we've also been asking that this be done in the hospitals.
Okay.
So it is up to the member states to have that kind of surveillance, vigilance, the background, as well as to have specific vigilance through the testing for the COVID-19.
You mentioned vulnerable populations as the elderly, one of the vulnerable populations. It's important, I think, to look at how the virus has impacted different parts of the world. In some countries, it's been primarily the elderly that have been sick and hospitalized. In other countries, young people are being hospitalized as well. Is there any kind of guidance in terms of what we can expect in this region for people who will be severely impacted?
So let me put this into perspective. The persons who are more likely to get severe illness and die are the persons with chronic diseases, not just the elderly. And I gave you that profile. So that is why we also distributed for all of the countries over a week ago a profile of their burden of illness in the categories I told you: diabetes, hypertension, cancer, the age groups, smokers. So what we have been seeing more so when the pandemic left China and went into Italy and now the US and the UK. What we have seen, a few things. That first 100,000 occurred at a slower rate because the Chinese instituted measures, lockdown measures. They also had thousands of very highly skilled Chinese come from other parts of China. Remember, China is a massive place. And they built special hospitals. So they had capacity for that very severe and severe and critical illness. And they were able to contain because they kept people home so it could not spread. So that first 100,000, because it was mainly concentrated in the East, occurred slower. When you got outside of China, there was not that attention to the disease and how it was spread initially. And so a wider range of people got this disease early. What happened is that they went home and they treated themselves, and then because they were congregating, a lot more young people got the illness than got in China originally, because China also had I think they had a school break, something like that, so the children were not in school. What we have discovered now in looking at the science behind what is happening is that children do contract the illness, but they do not usually exhibit in large numbers a very severe form of the illness. And so once it came out of China, what may have happened, this is conjecture on my part now, is that because they weren't paying as much attention to the spread, that children would have been not seeming to be ill, but spreading it. Spreading it more widely. And because people were not staying home and restricting how they went for food, they were still congregating, younger people got it in more percentages than they would have got it in China. And so we are seeing younger people from Italy, and this is why they're not putting persons in some regions, because the north of Italy is very bad, but the issues throughout Italy. They're not putting persons on ventilators over a certain age in some regions. Come into Europe, the rest of Europe, US and UK, same pattern. This is a mild disease. We have good health systems. We are not paying attention to how it is spread. We also have more of a focus on ensuring that business continues. And we don't do social distancing or enforce social distancing measures. And so you're seeing, and the other thing too is their mode of transport.
Yes.
In the Caribbean, we do a lot of transport in cars.
Yeah.
Some buses, but we do not have the tube.
Yeah.
We do not have the underground.
Yeah.
We do not have the subway.
Yeah.
And those are breeding grounds. Because you've got many people packed into small spaces.
That's right.
You've got multiple surfaces that people are touching. It's difficult to keep clean, and COVID lasts on surfaces. So you have certain cultural ways of spreading that you cannot avoid. If you're working, you cannot get in your car. You have to go into the tube. You're going to get it. So these are some of the societal and cultural issues that we have also been watching, because this is very much a disease of human behavior.
Yes.
It is spread. And this is partly the reason why I pay so much attention to Italy.
Yeah.
Because Italy, the Italians are like Caribbean people.
Very
They like
affectionate.
family gatherings. They like to get together to eat and to line. They like fetting. They like hugging up. They like kissing up. And so the culture is the same. So the patterns of behavior are similar.
Yeah.
So that's why we've been watching Italy. They have systems that are deeper in terms of what they can do, how many people they can cover at the same time, the doctors, the ventilators, etc., etc. So all of this we have been watching and weighing and trying to advise, but each country is making their decisions.
Yeah.
That's right.
Dr. St. John, you know, you're totally right. The Caribbean is definitely the most beautiful place on earth. All these Caribbean countries. And we thrive on tourism,
Yes.
which, of course, when it comes to getting viruses like this one, comes from elsewhere, doesn't start here at home. And I'm saying here at home from a Caribbean standpoint. What is CARFA's advice in terms of going forward or moving forward, especially in tourism, for us not to get things like this when if anything else should rear its head following COVID-19?
So before we leave COVID-19, we have to look at this whole issue of these protective measures.
Yes.
So these protective measures are going to have a cohort of people who have not been exposed to the disease. They're more vulnerable in the population. So what we have to look at is when we decide to encourage tourism again.
Yeah.
Because I don't know if you've been noticing, but China did not have new cases for some days, and then there are reports of
An imported case.
yes, and putting down the borders of Wuhan, and people moving around again. So there are other countries, not China, there are other countries in the East that are now seeing waves, second and third waves.
Wow.
Because this cohort of protected persons, there is movement from other regions into regions where people were protected, and now you're getting transmission, not from outside, but from within, but a different geography. So you can have waves. So how we manage this disease over time is going to be critical for saving lives
Yeah.
as well.
Can I ask, because you
When
mentioned...
we talk it, let me get to your question, because this is a very important question. And this is why CARFA has been working with the tourism industry. Not just for messaging in the early days so people understood what this was about, but also we are working with our tourism partners to do training for frontline workers, so they know how to protect themselves as well.
You mentioned the similarities in behavior between Italians and the Caribbean. Can we be optimistic when we look at our population density in the Caribbean versus what we see in China or Europe or even in the States, in the United States?
But there are pockets with high density in all of the countries you just said. So the whole issue is not so much the density, but how you work with the density. I don't know if you're aware, but in many countries in the Caribbean, supermarkets, places where people have to go, they've set up hand wash stations outside, or they're giving you hand sanitizer, or they're wiping down the trolley handles with sanitizer. They're cleaning surfaces. So even though you may have a scenario where people have to go, they space it. They only allow a certain number of people in at one time. they space how you line up to pay for your food.
Yeah, we're doing the same
It's-
here.
Right.
Yeah, yeah.
So don't look at density, look at how you deal with the density.
Well,
Because there's always a way to deal with it. And the other thing too is the most vulnerable. A lot of people are locking down their parents. There are nursing homes that are closed to visitors. They're monitoring illness among their staff and so on. So there are ways to deal with an issue.
Dr. St. John, in public health, the greatest challenge is getting people to change behavior. And oftentimes people feed into skepticism or misinformation, and the other extreme, which is panic and fear. What's the right balance what's been effective in helping people to understand that we have a role to play in reducing the spread of the virus and taking action effectively?
So one of the things is the information we give and the way we give it.
Yeah.
Okay.
It should be targeted to special interest groups. It should be targeted to certain age groups. And also the next thing is the enforcement. You cannot have a disease so transmissible without government enforcement of certain measures and punishment when people do not do what they're told.
Yeah.
Unfortunately, this is the situation with COVID.
Yes.
And so the constant monitoring of your systems, the constant looking to see what went wrong and improving it. If you didn't have a message that was understandable in English or any other language, change the level of language so that everybody can understand. Have special messages for children, have special messages for teachers. Well, most schools are closed across the Caribbean. But that type of thing. But on top of it is this whole thing about government enforcement. There are some interest groups, there are some faith-based groups that are saying that you must come to church. No. You can gather in your living room with others. The fellowship is not a function of a location or a building. The fellowship is a function of your faith. The enforcement of those people who, for whatever reason, and we're seeing a lot of strange behavior across the world. It's not something specific to Caribbean. Some of this is triggers for persons with personality disorders or some other mental health issue, because there's a lot of mental health and mental illness that can function in a normal situation, but en masse in high stress situations like this.
Yeah.
So some of the behavior and the recklessness is not just someone being wicked, but their illness, their mental health illness, mental illness coming out.
Yeah. And that's also another area that we can expect to see some impact in how healthy, the mental health of people as they are quarantined or isolated or locked down.
Oh, we're seeing it already.
Yeah.
Even me, because I'm working so hard and there's so much stress, not sleeping that much because there's so much work to do,
Yeah.
I get testy. And I'm not nice when I get testy. But everybody, you cannot be immune to this. There is an information overload. If you turn on the TV, it's COVID, COVID, COVID.
Yes.
As so much a human can take.
And especially when so much is still uncertain.
And so much is negative.
Yes. Dr. St. John, if you were to, there's a lot of people watching. We see the stories coming out of Italy, and it's scary. What do you think will be the most significant step that collectively as a Caribbean we need to take that will make a difference in being more like Germany than Italy?
Germany or Singapore.
Yeah, or Singapore, yeah.
Yes, the testing. I keep talking about Singapore. Testing. The strong public health measures, the contact tracing, the quarantining, the isolation, the geographic isolation, so you keep it contained, and then how that is married with the government interventions to enforce this whole issue of social distancing.
Okay.
But now let's go down to the personal level.
Yes.
Let us be our own brothers' keepers. Do not violate personal space. If you are feeling ill, it's a mild illness, do not come to work, do not go to church, do not go to school, do not go into bars, do not go on the beach, do not say you're going to sweat it out outside, keep yourself home. If you are deteriorating, you call, you do whatever the government is suggesting to you to get attention. Some people have gone to clinics, whatever. Do not just walk into your doctor's office and sit down beside the old granny with hypertension.
That's
We hear
a
you.
very important point.
We
Brother,
hear you.
we need to be our brother or sister's keeper.
Yes.
Very critical point. Just one last thing. What will end the pandemic?
After a phase of extreme illness and unfortunately death, most people, and there's some countries that are estimating that 80% of the population will get it. Most people would have got it. Luckily, most of us would have been mild, but there are going to be some of us who will come into hospital and may be affected if we survive by lung scarring, because that is one of the things that has been seen. I am also hoping that it will end because there was a development of treatment, safe treatment. There was development of vaccine, and it was shared, because we are already seeing that some people have decided that they are going to keep this and use this for profit. So I am hoping that we will not let profit take over. The other way in which this epidemic, this pandemic will end is with a cleaner earth. Because we're not driving around, we're not working, so we're not producing the things that pollute the earth. We're staying home. We're being careful with how we stretch our food, because food can't last forever.
Yeah.
So it will be a cleaner earth.
All right. Well, we really appreciate you being able to share your expertise with us this morning and adding to the conversation here in Belize.
Thank you.
Thank you. Thank you.
On to my next meeting, which starts in 15 minutes.
Oh, okay.
Thank you, Dr. St. John. All right, we're going to go ahead and take a break. And when we come back, our focus is on mental health and, more importantly, how to have the conversation with your children about what's happening. So please stay tuned.
And welcome back. We're moving now into our second conversation for the morning. And this morning we'll be talking to the experts about how to talk to children about COVID-19. Now in to tell us all about it, we've got Deshane Lopez, who is a psychologist, and we also have Elisa Habet, who is a mental health therapist. Ladies, good morning, and it's so nice to have you in. Welcome.
Good morning.
Good morning.
Good morning.
It is real as real can get. We talk so much about the boogeyman. We talk about all these different things, but COVID-19 is definitely one that you need to have the conversation with. Let's get there. And firstly, how to start a conversation with your child or children.
Well, I think one of the important things before you could have the conversation with your children is you have to focus on yourself, because children are very receptive to their parents and to the adults around them. So before you could have a conversation with your child, you need to do a self-check in terms of how are you feeling with this. You know, as adults, we are at the front in terms of knowing how drastic this disease is and how fast it's spreading. And so we are also anxious as well. And so it's giving us time to relax, process, identify how this is impacting us. What are we going through for ourselves, so that when we have the conversation with our children, we're calm. Because if we're not calm and we're talking and we're telling them, no, don't worry, they're going to realize that I should be worried because you're telling me not to worry, but you're worrying, right? And so it first starts with the adult. How do you process what you're experiencing? This is a pandemic that is affecting everyone.
Yes.
There comes a lot of stress. There is a lot of uncertainty. There's not a lot of information about it.
And we don't like uncertainty.
And we don't like uncertainty. We like to plan, we like to prepare. And so now we're trying to prepare, but we don't know prepare for what or how, what is the extent. And so as much as new information is coming, since it's been happening for months now, we're at a better state compared to other countries because we have more information than they had when they had their first case. But it doesn't mean that we're not in that panic state either. And so there's a lot of things that is happening. We're panic shopping, we're planning, but we don't know what will happen, so we still can't even predict. And when we're unable to predict, that gives us our stress level. So we become stressed when we don't feel that we're able to manage with the situation that is coming. So we have this impending doom that is about to happen.
Yes.
While there's a lot of cases of people recovering, there's still a lot of promotion, I would say sometimes, that there's a lot of talking about the death toll. Now, our country is small, so even if they're saying that 80% of the population will recover, 20% of the population will have more difficulties. And so that is scary because we also have a country that has high hypertension and all these things. So apart from the old age, we also have the underlying conditions. And so we have a lot of that in country. So that makes it more scary for us. So how do we process in terms of how do we relax? How do we manage? How do we change now with this new lifestyle they're telling us to stay in?
Tell me, how do we process and how do we adapt? Because some of it, I was saying yesterday, it's, you know, they call it the new normal. Some things I don't want to be normal. Hand washing, yes. I think we should all embrace that for the rest of our lives. But the distance is hard. You know, we haven't seen you in a while. We can't hug you and say hello, congratulations. We can't see, some people are not visiting their parents anymore. Some health workers don't have their children at home with them. So how do you adjust to some of the changes that are very different from your norm?
Well, I think adjusting comes with understanding the life cycle, so to speak, for what's happening. So right now they're encouraging social distance so that we could manage the disease as much as possible. So this is something temporarily, right? The good thing is we have electronics, we have internet that makes it a lot smaller. So while we have to maintain physical distance, we don't really have to stop social communication. And so that is something that is a plus in terms of, yes, right, for now we need physical distance. We could still engage with each other. There is Facebook, there is WhatsApp, there are different social media that you could still be present, you know. So for example, if we have family members in the States, we've probably been doing it for a while, still socializing and still engaging, and they're probably in the house participating with every single thing. So
Come
for
sing
now,
happy birthday with us.
it's adapting, And it's going to take a while to get used to in terms of, okay, I'm used to giving hugs whenever I meet someone, and now that changes. But the hope is that this will be temporarily until the researchers and the scientists find a vaccine to help mitigate the disease. So for now, yes, it is difficult because we're accustomed to it, and we still constantly have to be like, oh, wait.
Yeah.
You know, have to do the elbow box
I
and
know,
the ankle,
yeah,
right?
foot,
The
just
foot.
wireless.
Yes, you know,
Yeah.
so it is difficult. It takes practice.
Yeah.
And it's a matter of, okay, we're in this, but we could adapt to it. It's not lifelong, especially the physical part. The hand washing thing, I think culturally, we are a culture that washes hands a lot. So
We are?
I do believe
Well,
we
the
wash-
20 seconds.
Well,
one,
but the
yeah.
whole in
Oh, yeah.
detail one, we may not go as in detail,
Yeah.
but you know, it's just adding on to what we already have. So it's not a brand new recommendations that they're giving.
I like what you're saying. So a part of bringing yourself to a place where you can have the conversation with your child is just some of the self-talk. Like, this may not be my regular routine, but this is temporary, and this is to help save lives. Maybe that's, I'm being a hero because I stay home.
All right.
Yeah.
So I definitely want to bring in Elisa. You know, as a therapist, there's so many things. There's so many things that you've seen, you've heard, and having COVID-19 now on board, it's real. It's in our country. How do we process this? Because we had a conversation a while ago, and Marlene was like, you know what, you need to calm down. You
No,
need to
I
cool
didn't
down.
say calm. I just see the concern on you.
In other words, because
Yeah.
because I was concerned. So let's get to how do we get to calm nerves?
Well, I think first that we have to know what is anxiety. So for our bodies, for our minds, we're always trying to reach a point of homeostasis, like some type of balance here.
Yeah.
And what happened in the world is that we're on tilt.
Yes.
So we don't know how to cope with it because it's something new, it's something unknown. And when something is unknown, then you have no idea what to do, and then we don't have a cure yet. So everybody's freaking out. And one of the things that I find that we're beating ourselves up. Yes, we should have taken action since January, but we're here now, and I think we're doing well. Everybody, when I walked the streets yesterday, barely anybody was around. Everybody's practicing social distancing, so I applaud my Belizeans for what they're doing now. They're backing around their hand sanitizers. So how do we adjust from normal living to the now living? Is just accepting that we are here now. And I know we wish that we could go back to hugging each other and to being around each other and to the parties. But we have to focus on loving each other as a people. When you love each other, you're going to do the things that you have to do. And by doing that is practicing social distancing. So that is what we do. We love our fellow Belizeans, and we just adjust and know that it won't be long. Just be patient. You could do it.
We're not in a permanent state. You have restored calm just within a few minutes, ladies, because you just reminded us of the most critical parts.
Yes.
We're doing this for ourselves, for others, and this is only for now. There is a light at the end of the tunnel, and we will get there.
So it's also about, so how do you manage? You asked this
Yes.
question like 2 times already. So how do you manage? So one of the first things is identifying the changes that you're experiencing.
Okay.
There's a lot of physiological changes that comes with anxiety, that comes with stress.
Yeah.
The sweating, sometimes it's the thoughts running. There is difficulty in your sleeping pattern, your eating pattern. There's different changes that you'll start to identify. So it's good to be aware of what is happening in your environment. So there's a lot of changes, and there's also a lot of changes physically and emotionally. So you want to be able to keep abreast in terms of what is happening to me right now. So the minute that you can recognize what is happening to you, then that puts you at an advantage, because now you're able to recognize the changes that you're experiencing. And then after you recognize now is how do you redirect,
Okay.
right? How do you relax? So as I mentioned, there's a lot of physiological changes.
Okay.
And so when we in that state, our body is going chaotic inside. We're not able to see, but we're able to experience it. So we want to reset our body so that we're able to relax. So there's breathing exercises. So it's not a regular breathing where we just and you see the chest goes up and goes down. No, it's breathing from the diaphragm.
Okay.
Right?
So this sounds like a demo moment. All
So-
right, let's go. Do we need to
From
stand
the
or we
stomach.
could do sitting?
You can do sitting.
Okay.
So if you sit, so if you notice if I put my hand on my stomach and I say breathe in, my stomach's push out. And when I say breathe out, it goes in. So that helps to reset more than because we're putting pressure here and we're not really resetting our body to relax. But when we're doing it from here, we're focusing our attention in terms of our stomach muscles. And what that does, it slowly reset our body, that we put our body in a sense of calmness. So we do that in sets. So I always try to teach people in sets. So I always start from 3. We're going to do 1, 2, 3. When I say breathe in, I want your stomach to expand. Right? So let's try it. 1, 2, 3. Breathe in. 1, 2, 3, breathe out. 1, 2, 3, breathe in. 1, 2, 3, breathe out. 1, 2, 3, breathe in. 1, 2, 3, breathe out. Now, different people have different number that they need to reach for them to reach that state of calm. I always start at 3 just to get people to practice, because sometimes people go with the chest part more than the stomach part, right? So we start there. But for me, for example, my number is at 8. So I have to hold my breath for 8
seconds.
count to
Say about
8,
8 seconds.
then breathe out.
Okay.
And that calms me down. So it takes practice to figure out what is your number, what is your comfort. But that helps to reset the body physiologically, right? It's also about mindfulness and being aware of what's happening. Looking at how can you distract your thoughts, because a lot of time you always have a lot of thoughts and you're thinking about all the craziest things. We always go worst case scenario. But when we go worst case scenario, we don't think, okay, so what can I do if this happened? We don't go in the action part.
Oh, we just worry that
We
it's
just
gonna
worry
happen.
that it's going to
Okay.
happen, and we don't go in the action part. So that's the part where we come to redirect. Now, there's
Yeah.
a lot of changes happening in our environment. There are a lot of things that we have to adapt to. There are a lot of things that we're going online now. Things are shutting down. Some people are no longer at work. They're at home. And so there is what do I do now? And so while the country is in this space of limbo, what can you do at home? So when you're at home, there are still things that you can do. You can still go in your yard, you know, because so you still have that ability. You can still have things that you can
Get
engage.
fresh air.
Fresh air. So this is also a time to rebuild in terms of family, that reconnection, because if you're always at work, now you have the opportunity to be at home with the kids.
Yes.
And so you could redirect. So what are some of the things that you wanted to do but you never did because you had to work? Now is a good opportunity to make use of the situation, you know? So once you're able to think in terms of that aspect, then you could have that conversation with your children. So the Caribbean National Alliance of Psychologists had a list on their website of things of how to have this conversation with your children.
Okay.
So one
Can I just interject there? I think a lot of parents think that the kids don't notice. That's the first thing. How aware of them are they of what's going on? I mean, like what age at what age do they start to realize or be aware of what's happening around them?
From birth.
Really?
Okay.
When a mom is stressed, the baby's picking up
Okay.
from early on,
Really?
right?
Yes, from birth.
So people are thinking their toddler is fine, but the toddler is aware that something is
They
happening.
don't know what
around.
is happening, but they know that something
Something
is
is
happening.
happening.
Right? The changes, they're able to detect that there's change and there's distress, and so they're able to feed from that.
Okay.
So when parents are distressed from babies are able to detect. So you notice people will cry even more because you're stressed, and then you get more stressed. So children are more susceptible to emotions and what's happening.
Okay.
And so while they may not understand in details what's happening, they know that mommy isn't happy, daddy isn't in a good place at this point.
Yeah.
So they're very aware of what is happening. So it's also having the conversation with your children, you know. There will be changes that you may see in terms of your pattern. There may be more excess of the behavior that you're seeing at home, or they may go completely opposite, and you're wondering what's happening. I haven't even had the conversation with my child. Why is my child acting up? They're sensing. And also, we watch TV a lot. We're on the internet.
Yeah.
So they're also
They're hearing
aware.
it.
They're hearing
Yeah.
what's happening. So I also recommend in terms of reducing the amount of time that you're watching all the updates. You know, as
Yeah.
parents, you could have it on your phone or having it on speaker to check in if that's what you want to do, but not having it on your big screen TV at home all day. So that's all that they're focusing
all
on.
they're focusing on.
Right. And at this point, especially because things are new and we have our first case on Monday, While school send home homework, I would recommend focusing on quality time and having engagement and fun rather than focusing on, okay, get back to work.
Can you say that again? I sent this to one of my friends yesterday. I said, we are in a health emergency, not an education or school emergency. Yes, teachers, we're saying they'll do their schoolwork, but can we just refocus now on getting everyone in a healthy space?
Yes.
This is your recommendation
Yes.
from the psychologist. Wonderful.
Yes. So at this point, we want to put academics at the back burner. We
Yeah.
want to focus on the emotional state and having the family being able to adapt. And we can't be adapting simultaneously and just focusing on academics because we won't be able to focus. If we're stressed, it's hard to focus on the schoolwork. But if we give time for us to process and then figure out a strategy in terms of how to cope, then a week or two from now, depending on how long this is, then we put back in the schoolwork. But at this point, it's focusing on the emotional part, letting them being aware, but also engaging in activities. So this is a new opportunity. Parents are home, brothers, sisters are home. Let's try to engage. Let us pull out the card games, the old-time games that we used to have to start to engage. Because when we're doing that, while things are uncertain, we are certain of what we're having at this moment. And so that is very important.
So we know now that the first thing we want to do, because it is having that conversation with the child or the children. As a matter of fact, I put it into the context of having that conversation with the family. First things first, you need to calm down. You need to relax, and there are different ways of how you could do that. When you're delivering your conversation about any disease or anything that you know that you're scared about, how do you deliver this message? How do you, in what context? Do we do it in a fun way? How do we do this?
It all depends on the age range, right?
Okay.
So depending on the age of your child, then you decide if it's going to be more friendly, a little bit more just pure facts. So it all depends in terms of, and then you have to know your child. How do they receive information? Because that is also important, right? One of the things, so for little children, having fun, so washing hands. There's a lot of YouTube videos that have songs that you could wash your hands and all these things.
Oh,
They love playing with the water.
And
So that's
right?
easy, right?
So, and as they get older, then you want to be able to explain, but also don't talk in this doom fashion as well. You still want to be cognizant, okay, so you're aware in terms of the information that is happening, but there's also the positive that is also happening as well. So you want to be able to be direct in terms of the conversation and try not to not necessarily hide the information, because they also sense when you're holding back as well. So again, it's preparing yourself in terms of what else you need to know. Okay, so there is a virus. It's going around, and talk about how it spreads and what are things that they can do. So remember, whenever we feel stressed and anxious, is because we feel we're unable to do anything. And so some of the things that you can do is practicing the social space, the washing hands, and keeping the space clean. Right?
So, you know, I think you have the conversation with your child, and you were so right when you said they have exposure at all levels. So even if they're doing tablet or internet, maybe they see, oh, things get really scary, people are dying, and mommy has to leave for work or daddy has to go outside. How do you minimize it? Because I could only imagine the fears they'll develop if they think outside is evil and mommy and daddy are going out into it. So what do you say, and how do you help them realize that you're also keeping yourself safe? Advice? Yeah.
Well, so it's the same thing. You're letting them know in terms of what are the precautions that you are taking.
Okay.
You know, and how can you protect yourself. So the same way that they are protecting themselves at home, these are the things that you are doing so that when you go, you're able to do it. And also let them know that it's not walking outside that will cause you to get the infection, but it touches surfaces and it touches your face and all these things. So you want to explain to them in terms of what's happening at home and what happens when we're at work. And especially for parents who are at the front line. You know, that makes it even more anxious. So there's a lot of stay home, because we have loved ones that are at the front line as well. So it's also letting them know, okay, at home, at work, these are the steps that we're taking. So let them know, rather than having
that
them...
you're protecting
yourself. Yes, that you're protecting yourself so that they don't have to speculate what's happening out there, right? You let them know from the beginning, these are the things that are happening, these are the changes, and this is how we're going to deal with it.
So since it's, you said it really clearly, and I never thought of it, we are fresh in kind of facing our reality. And so it's a good time to focus on just getting everybody in the best place possible.
Yeah.
But at some point, is it important for us to set routines for the day as well? Because we're looking at 4 weeks of unscheduled time or self-regulated time. And I know we always talk about keeping kids on routine. So at what point or how important is it or necessary for us to do that?
It is important.
So,
Yeah.
Sorry.
so routines are very important in every day.
Yeah.
We need a routine. So when you get up in the morning, you have to stay consistent. I will get up at this time and I will do this, this, this. But oftentimes, a lot of people are afraid of routines because they think that routine is boring. But the trick to a routine is that you make a routine that is fun for you. So maybe you put like 80% responsibility and 20% fun, just to reward yourself.
Yeah.
So we could implement that in this new time.
Okay.
That- especially because kids do need routine. Everybody needs routine, but because they are not in school and they're used to routine, they're going to be idle. And then they need that mental stimulation. So yes, I suggest making a routine that will make them have fun, but also learn.
Yeah.
Because they need to learn. They need to develop their minds because it's going to be like a month break. What are you going to do with just being idle like that?
Yeah.
So
I know.
All right. So
Planning.
planning.
So like I said in the beginning, you want to be able to process information and feelings.
Yes.
You want to be able to process feelings. And after that phase, then you start to introduce different things. So you know, okay, what would be our morning routine? Will we clean the house first? Will we watch TV? Will we play a game? And how long will we spend doing any assigned work, right?
Okay.
So if you spend 2 hours doing work for school, then the other one will be household activities, and then it's just game and fun. Because you want to be able to have a little bit of everything. You don't want it to just be fully focused on schoolwork or only doing household chores. You want to be able to have
TV time.
or TV time. You want to be able to have as much as possible.
Yeah.
But I also want to say also, if TV time is one of the main things that child only have access to, it doesn't mean that you're a bad parent for allowing your child to watch the TV, right? We have to be real that sometimes parents do still have to go, and they won't be someone that's going to make sure that they stick to this
Yeah.
routine. And so even if it's watching TV, if they're safe, they're fed, that is very also important, because we also don't want to cram them up at another family member's home,
Yeah.
because this time also create a lot of other challenges that may arise psychologically. You know, we don't want to put them in harm's way as well.
Yeah.
So it's also something to be mindful for. So I always
Yeah.
want to say, if your child is watching TV and it's safe, that is also okay. You're
That
not
is
a bad
okay.
parent. Because I think also as parents, is what I'm going to do with my kid, I'm a bad parent, I can't
Yeah.
focus. Who, you know, so
Yeah.
it's also lessening the pressure for parents that they don't have to feel that level of
No,
guilt.
I can't
I can hear you
imagine
breathing
it.
now, yes.
I've been thinking about this. I think being locked up at home is going to be challenging for adults. You know, everybody's going to feel a little
Grounded.
stir crazy after a couple days. The issue, though, is, and I really feel that we've not acknowledged the high risk situation that may happen. If I'm already a very violent parent, or I kind of, lash out,
Aggressive, yes.
and I'm highly stressed. I mean, children can be vulnerable at home, even with parents or caretakers. So it really is critical that we're mindful of where we send them and what circumstances they'll be under as well.
One of the things that I definitely want to touch on is that, of course, we've mentioned dealing with children, but at the same time, we might now have teenagers who are, then again, another extremely vulnerable population in terms of, how information is dispensed to them. And I want to get to Elisa
Or
once
getting
again.
them to do things.
Getting
I know
them to do
parents just like
things.
raise the
And-
volume on the TV.
Probably they've developed some kind of mental health issue, disorder, and it might be hard for us as parents to deal with them knowing that there's a pandemic across the earth. What are the conversations we must have with them to try and get them to calm down and try to get them to relax?
Well, how you do that is you basically just sit them down and you tell them this is the state of the world, and show them the statistics, show them what's out there. And that if we work together, social distancing, making sure that you have proper hygiene, that you're going to be okay. There's no need to panic. I think one of the things that the whole world is at uproar is because we have this need of socialization. And that's why we feel so caged. Even me, I want just bust out and be free and hug everybody. God knows I love hugging. But socialization is such a need. But also I find that we're also isolated. When we go and work and we come back home, we immediately go to the screen. And like Miss Deshane say, that we have to focus on quality time, on spending time with each other.
Oh wow. You wanna chime in on that? Or?
I just want to say a lot of teens are already screen friendly already. They're in their rooms on the devices as well. So it's also just letting them know what is the family perspective.
Yeah.
Because they're going to hear a lot of things, they're going to be introduced to a lot of information, but what is the family stance? You know, and that's security. So it's also all about grounding them and giving them security as a household, rather than just having them feed on information that they're hearing. What is our family plan? How do we plan to take care of ourselves as a family? So if one or two person have to work, what are the precautions? What will happen when they get home? How will they take care of themselves to cleanse themselves before they enter into the home? So it's creating that this will be our norm so that they feel safe. So it's all about, so when we talk about routine, it's predictability.
Yes.
And so if we could give them information so that they could predict more or less, then they're a little bit more calm.
Yeah. And what I hear from you very clearly is it's inclusive.
Yes.
It's not saying you're going to do this, and this. It's kind of like working out the plan with them.
Yes.
And that gets them on board. Is that the idea?
Yes. And then it's more, okay, we can all do this. So how could I be a part of?
Yeah.
So when you feel that you're able to do something, remember anxiety is always when you feel that you have no control and everything is happening and you can't do anything. There's this panic. There's this sense of I have no control, no security. So if you could provide that and you could create that together, then you have a higher chance in terms of one, a buy-in, and two, they're a lot calmer because they feel like I can do something. So washing my hands, making sure the house is clean, keeping my distance. I am doing something so that I don't get infected, my family members don't get infected. So I feel like I have control at least of this area. So we can't control other people, but if we control our household, then we feel a little bit calmer in our home.
Sweet.
All right. Parents are watching. Tell us what else. Any tips that you want to give parents right now in what is a very unique situation?
Honesty. I think honesty is very important.
Yeah.
Talking about feelings. So we're not a feeling person, that's how we talk, but it's also talking about it. So we're getting a lot of information in terms of washing your hands and doing all these things. But how about the feeling? Can we talk about our feelings?
How do we ask the feeling question? Because it's not, are you scared? Or
no, it's not just, are you scared? So you could start with me. So for example, you can say, well, there's a pandemic going around, and we're doing all these things. I am scared. I'm not sure what is going to happen a month from now. So I'm nervous. I'm scared, and I want to know if you're feeling scared and nervous too. If there's any other feeling that you're feeling right now, and that way they could start that conversation. And sometimes they may not want to say. So there's different things that you can do. Children and teenagers love to draw. So they could draw. You could have them. Give stories and then have them just give their interpretation of what's happening.
Okay.
You know, relaxing. So there's adult coloring for teenagers. You could have them coloring and you could have the conversation. You could be listening to music while they're having the conversation. And it's just talking in terms of, if we could say what we're feeling, then they will feel a lot easier to say. And let them know that there's no wrong feeling.
Okay.
We feel what we feel because of how we interpret information. It may not always be accurate, but we could always discuss that. And so it's having that space to know that if you're feeling annoyed right now, it's okay. If you're feeling frustrated, it's okay. It's okay to have the feeling, to identify the feeling. And if you're feeling like I feel 3 different feelings at once, that is also okay. You're also verbalizing what you're experiencing, but it's also letting them know that it's okay to name what you're feeling. And even if that feeling is confusion, it's also okay. So you saying it for yourself and letting them know it's very okay to have that feeling.
Okay, so I think what you're saying is so clear. And perhaps one of the worst habits we'll have to break is when the kids say, I feel scared, is, no, you don't have to feel scared, or you shouldn't feel scared.
That doesn't work,
We
though.
really don't want to say that.
Because when you do that, they get scared even more.
Okay, so what can I say when they tell me they're scared? Because that's a natural reaction. It's like, no, don't be scared. You shouldn't. We're
shouldn't
taking
be.
care of it, you know?
So one of the things that we need to do is acknowledge their feeling.
Okay.
Oftentimes is the way how you responded. You don't have to feel scared, blah, blah, blah. It's already defensive.
Yeah.
So the parent is already defensive, already like hitting you like, you don't have to feel like this and so
Yeah.
on, right? So you first have to acknowledge, okay, I understand that you're scared. Why are you scared?
Okay.
And then they say maybe I'm scared because I can't see my friends. And then you could say it's okay to feel scared, and maybe we should check on your friends. You know, get involved with the child, get involved in their world. Oftentimes,
Yeah.
maybe parents don't really care about the friendships of their child, but they should care because that is their need to socialize with people. And so you just acknowledge them, and then you try to find out why they're scared, and then you could suggest in ways, you know, try to feel them. Empathy is the biggest thing.
Excellent. Cool.
That is a great recommendation right there. So
Definitely.
that's step number one, right?
And there's also some resources online that you could find that has children's storytelling in terms of how to talk about the virus. So, like I said, the Caribbean National Alliance has on their link
Okay.
storyline that was created by Mind Heart Connect that talks about how do you talk to your children about virus. It's very cartoon-like. And so sharing it in a cartoon figure, so you ask in terms of how do you tell smaller children. So you can do the songs, you could have it in a story form to let them get the
Nice.
information. So
Yeah.
there are resources that you could tap into that is child friendly, that is that you could use, and you could determine if my child more likes to sing or if a story will be much better, right? So it's always about being upfront, but also not just focusing in terms of just the hand washing, but also the emotions. It's very
Yeah.
important to acknowledge the emotion that is happening.
And age-related
And
information.
age-related information.
Ladies, thank you so much for contributing your expertise and helping us collectively recognize that we have to take care of ourselves. We have to recognize, relax, redirect that energy, and most importantly, recognize that our children are paying attention and we must talk with them as well. Thank you.
Thank you too. So
Okay.
I just want to chip in that we're now offering services online.
Nice.
Because of the recommendations given, we're not offering services at our office at Buttonwood Bay. So we're strictly online at this point.
Okay.
Because we want to be able to, because we know mental health is important.
Yeah.
But we're also following precautions.
Yeah.
So if you want to access services with any one of us, you could reach us at, you can check us on our Facebook page at Counseling and Psychological Services.
Counseling and Psychological Services on Facebook,
On
and
Facebook.
we can figure out from there how to make appointments online, and that's also